So in your view, what has been the biggest misconception that people have about acupuncture?
That one treatment is the cure-all. Or I have to keep reminding, this isn't magic. It's a cumulative effect, just like chiropractic care.
Welcome to Posture and Purpose, where both healing and community come together. Make sure to subscribe on Apple, Spotify, and YouTube. Let's get into this episode with Dr. Michelle Carr-Frank.
Hello, and welcome to this episode of Posture and Purpose. Today we have Ms. Donna Greene with Tranquil Pathways, an acupuncturist here in Lafayette, Louisiana, and we're here to learn about all the wonderful things she can help you with and all the things she does and the technology that she uses as well. So welcome. Thank you for being here.
Thank you for inviting me.
So tell us, how did your journey into healing begin? How did it evolve?
It was kind of a little magic carpet ride, I call it. I graduated at USL with a degree in psychology back in the 80s, early 80s. And then I went on to New Orleans and did social work for 12 years in the psychiatric hospitals.
Oh gosh, I bet you learned a lot.
Yes.
Life experiences.
I was very young, so I didn't know much when I got there. So while I was there, I was working on my master's degree in social work, and got sidetracked and ended up in nursing school.
Wow.
So while I was in nursing school, we had a family emergency, and I'm from Lafayette, and I was 2 hours away. So I just decided I think I need to go home. So I came home and was going to finish my nursing curriculum here, and ended up in massage therapy school. And that lasted, I enjoyed it, but I got bored like 3 years in. I'm like,
Where did you go to school?
At Blue Cliff School of Therapeutic Massage. So I graduated and opened my own practice and worked at the school itself for a little while. And then I got interested in Eastern traditional Chinese medicine. So that got me in a 20-month shiatsu practitioner program. Wonderful. And that was in 99. And then by 2003, I was in Houston in acupuncture school.
So you are a perpetual learner.
I am. And when people say, how long have you been in school? Since kindergarten.
Forever. Yes, that's good. There's nothing wrong with that.
Yes.
Was there one particular personal experience or aha moment that you really said, okay, I realize that I'm going to gear this towards more of a holistic path? Was there anything that really brought you there?
I think it was just going in for the massage school interview.
Really?
And it was owned at that time by a gentleman named Vernon Smith, who is my mentor. He was a shiatsu practitioner in California in the 60s.
Oh.
So his vision was to merge Western and Eastern theory into a massage school. That was his goal and his dream. So it was a simple interview with him about school, and he put me in a shiatsu class that was ongoing, and I saw a video, watched a video with the class, and it was called The Mysteries of Chi. Mm. And Bill Moyer did the documentary, and it was, I think that was the aha moment.
You knew that you were drawn to that for sure.
But it took a little while before my brain actually clicked over from Western theory to Eastern. That was difficult.
Really?
It was.
Why do you think it was difficult?
Because it's not the same. Mm-hmm. The theory is
completely
different, and it's more of an art.
It is. And that's hard to explain to people. You either get it or you don't. Or you
and it's
either
hard to
open
explain
your mind.
to a lot of
Exactly.
Patients don't get it.
And how did your training or education through those schools, how did it change your approach to healing itself?
Well, initially I didn't do well in massage therapy school in the energetic courses. I would get extremely overwhelmed. My breath would change. My body temperature would change. I was just really sensitive just to do an energy work, and I had to actually find a way to ground myself enough to be able to be around that much energy. So I enjoyed that part of learning. I think it was just trying to get comfortable in my own skin with another concept of medicine, because I'm very Western minded.
Right.
I love science. I love biology.
Right. Especially with your background.
Yes, and so I really had to learn to use my right brain, which I didn't have much of. I'm not very creative.
You had to get in tune with that part.
I did. So I ended up in acupuncture school in Houston.
Okay, that was my next question.
Yes.
How did those two things blend between your massage experience and your interest in acupuncture?
Well, I had a head start. I think I was probably a year and a half ahead of most people in school.
Really?
Because all of shiatsu is steeped in Chinese medicine.
Mm-hmm.
So I didn't have to study. I'd go to class and take notes and take a test and made an A. And then about a year and a half in, we had to start learning about herbs, which I knew nothing about. So that became a really big challenge.
And for those listening, could you explain in a brief explanation what Chinese medicine is? Some people may have heard of it, but what would your definition be?
Okay, so traditional Chinese medicine is about 2,500 years old. Of course, it's Asian, and it began basically with masters in what they, masters in body work and masters in herbal medicine. It was their way. I mean, it's a way of life.
Mm-hmm.
Tai Chi, Qigong. It's all about channeling and focusing energy.
Energy, right.
So their concept is not about disease, but about an energetic imbalance.
Mm-hmm. And prevention.
And prevention, definitely prevention. And it entails a lot of different things.
Oh, I know, it's fascinating. I love reading about it.
It's amazing, and you never learn.
No, more. That's what I was going to say.
Learning.
More people should look into it and learn about it.
Yeah.
It would open your eyes, open your
Yes.
mind to other practices and something that may
Totally.
help you. So,
Yeah.
so in your view, what has been the biggest misconception that people have about acupuncture?
That one treatment is the cure-all. Or I have to keep reminding, this isn't magic. You know, it's a cumulative effect, just like chiropractic care.
Mm-hmm.
You continue until you can get to a point where the symptoms have decreased, and then you do a maintenance.
Right,
So
and
I-
everything's in alignment.
It's all alignment, and I think people enjoy learning about it.
I hope so.
It's
I think it's
fascinating.
changing. More people are questioning those answers, and they want to know what their options are and how they can approach things more holistically.
Correct.
Instead of, chiropractors have been doing that for years. Acupuncturists have been doing that for years, but for some reason, these younger generations, I think, are questioning those answers. Well, maybe there's something else I can do. Maybe there's another option. I don't need to just take a pill for this or that.
Correct.
And which is wonderful, because Lafayette is lucky to have you here. How fortunate people are to have your services. So they need to hear about you. They need to know how to find you. And you mentioned working very closely with the human body. What do you think the body is trying to tell us when we're in pain or out of alignment?
I think most of the time people realize that they have to be a participant in their health.
Right.
And so they reach a point where they're like, oh, what I'm doing is not working. And I really need to be proactive.
Yes.
Or participate. And I give my clients homework. And,
Good.
I give them books to read.
Oh, good. You see, and it's about educating too. It's
Yeah.
not just, hey, I'm going to do this and let's cross our fingers. There's an educational part behind it as well.
Especially self-care.
Oh, yes.
Because I often think of I had an elderly couple in New Orleans who were my friends, and this gentleman, Mr. Vincent, was a barber. And all of the stories he's heard over his lifetime as a barber, And I realize now when people come in, they're not just there for physical care, but they're there for holistic care, so you can, be available to them in more than just that one way.
Yes.
They need to speak their story.
Yes, it has an effect on everyone's overall health.
It does.
For sure,
And
for wellness. So.
Yes, and I feel like that their ability to come in, sit down for 35, 40 minutes in a relaxing chair, in a recliner, listen to music.
Right.
Yeah.
It makes such a big difference.
Helps. It does.
And what are some of the most common physical issues that you treat at your clinic?
Depending on the age of the client, I have a lot of females with anxiety, depression, infertility.
Well, that was one of my questions.
Yes, I like that. I like doing that kind of work.
Okay.
And neuropathy, back pain.
A lot of diabetes patients, or
Not really.
with neuropathy?
Well, they come in because they have diabetic neuropathy, but they don't realize I can help them with the diabetes too.
Right.
It doesn't get them off of their medications, but sometimes patients can decrease their blood pressure medication dose or their metformin or whatever else they're taking. So, and I'm, because I like working with the doctor, I like when a patient comes in with a diagnosis, because then I can
where to start.
associate,
yes.
what I understand about the disease.
Right. And it's bridging the gap between the Western and the Eastern.
Yeah, it's gonna.
The only person that will benefit from those bridges would be the patient,
Correct.
the client. And that's what we all need to be open to, because not everything works the same for every person.
No.
So can you describe the difference between a relaxation massage and a therapeutic medical massage?
Okay. So the modality, more than likely. So Swedish massage is usually the relaxation, long strokes, not too much pressure, maybe some aromatherapy, and deep tissue or neuromuscular therapy. There's so many modalities now.
There are.
Yeah.
What are your favorites?
To receive or to give?
Well, I guess to give.
To give. I like problem-oriented. I don't like an hour-long session if I'm doing table massage. Now, if it's shiatsu, it's on the floor, it's on a mat, a lot of stretching. That takes an hour and a half. So that takes a little bit more energy.
Explain to the listeners what ashiatsu is.
Okay, so shiatsu itself, translation is finger pressure. And it's acupressure, but it's along the meridians. So it's not just a session of touching random points, or not random points, but only a selected amount of points.
Right.
Like we do with needles. We choose the points, we place the needle. But shiatsu is working the entire channel, each meridian.
Right. A lot of people don't know about it, so
Yeah.
I know they'll probably have questions for you, but what were you going to say?
Ashiatsu is on a table, and the practitioner uses their feet.
Right.
So you're not clothed, you're draped, but it's more deep tissue technique with the feet, as opposed to, I just always thought it wasn't named correctly.
Right. So when you explained the definition of it, that
I don't
that
know
kind of
what
surprises me.
ashiatsu means. I don't know that translation. But
Well, we need to Google it. We're
Yeah,
going to find out
I'll have
after
to
this.
look it up.
Yes. And you mentioned self-care. What's one small self-care practice that you wish everyone would do between sessions with you? You said you like to give your clients homework. What is something related more towards self-care?
I would like for all my patients to walk.
How easy is that?
It's
You'd think more people would do it, right?
Yeah, it's not a big request, and it's not a cardiovascular. It's just a walk, and there's a meditation walk. You could do walking qigong, which is just a distance, and,
Right. And a daily dose of sunshine comes
right,
along with it.
morning or afternoon, or that would be my request. But, not everybody can do that.
I know.
So
I
even
know.
just maybe outside in nature.
Yeah, I know we take it for granted. Of course everyone can go for a walk, but that might not always be the case, unfortunately. Mentally or physically, there may be restrictions there. So, and how would you explain acupuncture to someone who has never tried it and are very hesitant and are hearing us talk about all these different things and they're like, whoa, I have never heard of this explained this way? How would you explain acupuncture?
Well, the biggest question is it going to hurt, of course. But so when they come in, we do an assessment, and they're not very used to me looking at their tongue or feeling their pulse, or
Right.
so I have to explain as I go that there's 10 questions we ask about the conditions of the body and habits, emotions,
Good, yes.
temperature, body temperature. And then from that, we choose points that are most conducive to those symptoms. So I tell them that just like the nervous system runs through the body, these energetic channels do the same, often in the same pathway. And there's specific points on there that can manipulate that energy. So if there's too much energy, we can reduce it. If it's not enough energy, we can build it up and tonify it. So, they come in and they're like, I don't understand a word you're saying.
Right.
And I just keep telling them, if you trust me, I can walk you through the process.
Yeah, it's a lot about trust because, we work very closely with the human body. And some people, that just intimidates them when they walk in the door. You have to build that trust.
Yeah.
And are there any certain conditions or symptoms that respond to acupuncture particularly well, or others that may not respond to acupuncture so well that you sometimes have to work on it?
Yeah. I think digestive issues work well with
Yes.
acupuncture.
Yes.
And a lot of times I introduce herbs, because I don't have to continue to treat you with needles if herbs work better for you.
Right.
And they're not long-term herbs, so you take them until your symptoms go away. And, it's not like
Yeah, that's
what we
the goal,
do.
right?
Yeah, right. So I think what acupuncture really works well for is chronic disease that Western medicine has only found a way to deter the symptoms.
Right.
So I often say that, people say, well, do you treat yourself? I'm like, yeah, but, if I'm bleeding to death, I'm going to the emergency room.
Right,
I'm not going to
right.
sit around and put needles in
Right,
myself.
there's some common sense there
Correct.
to it, but
Yeah,
it's
so
knowing.
acute and trauma, Western medicine
Thank God we
covers
have
all
it.
areas, yes.
Right.
And then chronic things like high blood pressure, diabetes, gastritis, long-term depression.
So
These
that's
are
what
some
you see.
things, yeah.
Very, that responds well.
Yeah.
And what does a typical session look like for you and feel like to someone that's all new to it? How does that first session feel in case someone listening is willing to go and check it out?
Okay, so like I tell them, the first session's always the most nerve-wracking because you don't know what to expect.
The unknown, sure.
Right. So I just try to make them feel comfortable in my office before, ask them questions, kind of get to know them. And I'll do assessments over the phone. If they have questions, I'll do that over the phone.
Good to know.
Yeah, they don't even have to come in.
Great.
Because sometimes it's just the fear of needles.
Intimidating, yes.
Yeah.
Okay.
So my office is set up where there's 6 recliners, and they're kind of partitioned off with room dividers, so everybody has their own little piece of privacy. They take their shoes and their socks off, and their jewelry. Their pant legs have to come above their knees, and their sleeves have to be above their elbows.
Okay.
Because I use points from the elbows to the fingers, ears, scalp. Also do facial acupuncture or facelift acupuncture. So sometimes the face. So they're comfortable in the chair. I'm like from me to you from them because my office is right, the door's right there. So I always tell them, if you need something, just say my name.
Hello.
I'll be
Yes.
here. Some of them send me a text.
Oh.
They're in the back. hey, I have to go.
Oh.
Okay. So it's quite interesting how they just kind of sit there and realize, oh, wait, this is the treatment. This is what's happening. And some go to sleep, some snore, some play on their phone, some take pictures of their feet, and
Just like everything else, they respond differently.
yeah, and I'll just let that be. But sometimes it's just I have one patient who's been with me, I don't know, since I opened in the oil center, maybe 4 or 5 years. I go in there, her eyes are wide open. And I'm thinking, okay, maybe I'm not using the right needles
Is that an energetic?
to help her relax. No, I don't think she relaxes like the rest of. So I just had to let it be that way. I mean, that's her process.
Right, exactly. Well, that's interesting.
Yeah.
And okay, we talked about infertility. We just touched on it.
Mm-hmm.
How can you share with us something about infertility and acupuncture? And if someone is struggling possibly with infertility, what would that type of session look like with you?
Okay, so I have different kinds of fertility patients. Some have not tried any Western fertility measures. They've just not gotten pregnant. And then I have some who are receiving treatment, medical treatment. They do IUI or IVF. And then it's important for me to know which physician they're using, so I know which kind of format or plan they're on. And so we do this. I think the primary goal for fertility is to make sure they have a regular menstrual cycle for 3 months in a row. So I always ask, don't wait till it's time for, implantation or retrieval of your eggs. Come in 3 months before all of that, so we can try to regulate. And acupuncture is really amazing, how it can balance the hormones, because I always imagine how stressful. All the process of fertility is so stressful.
Right. Emotional,
injections,
mental,
everything.
physical.
And disappointment. I think that's the hardest part. So it's really, and just recently I had a baby shower to go to, and she was one of my fertility patients. I couldn't help her. I don't think she had the right medical diagnosis.
Okay.
And there was something a doctor could have been doing also. So she had a small surgery and got pregnant.
Gosh, how rewarding.
I know.
And building those relationships, too, with your patients.
Yeah, I was so happy for her.
Gosh, that makes it all worthwhile.
It does.
And how could people become more in tune to their body signals before it possibly escalates into pain? And of course, I could ask the same question.
Right.
People just, they don't, in my opinion, work on preventative wellness first.
Right.
But what do you see in your practice?
I think mood has a lot to do with people's health.
Oh, that's a good point.
And where they are, in their life process of, are they grieving? Things, life is one big grief process. And if you don't learn how to grieve well,
right,
then true. You can't get, it's normal.
It is. It's true, and we need to normalize it and learn to take those steps, whichever steps those are, and they're all different for each person, to learn how to deal with those challenges that life throws at us.
Yeah, and we get stuck.
We all do.
If we don't expect that everything's going to be changed at any given time.
Yes.
In other words, that's the only guarantee in life is if it's good now, it's not going to be later, and vice versa.
I love that.
I think the mood or the attitude we take towards life and all that happens to us, the grief can get us a good grieving process can get us to the other side. And a lot of people I don't know. I had to learn that young.
Yes, you're making me think about a conversation I had with my mother years ago. I was starting my business, and of course there's struggles starting a business and life in general. And I said, well, this happened this day, and then this happened on this day. 2 days later, this happened. She said, Michelle, when you realize that there's always going to be a problem. Every day, every other day, maybe you'll have a few weeks without a problem. There's going to be a problem. Learn how to cope with it and move on.
Great advice.
Right. And I thought, wow, that was such a revelation for me. Instead of myself worrying and stressing out about everything, I love how you put that. Grief. It is a form of grief because you're trying to figure out where to put that nervous energy and deal
Correct.
with it.
And I think too, through aging, when patients come in, they're like, man, I used to walk 2 miles a day. Now I can't, And I'm like, I'm not at that point yet, but I'm getting there. And I can only imagine what it's going to be like when I can't mow my own grass.
Right. And see, that's...
And how I'm going to feel about
right.
that.
That's mental.
Yeah. Mm-hmm. So I think our kind of embracing that part,
sure.
like, you hear your feet burn on, neuropathy.
Yeah.
And I think I use a lot of humor.
You have to.
Because and especially with Cajun people, they have great senses of humor.
Yes.
So,
We're so
they
lucky.
come in and tell me jokes and, my wife said I need to do this with my feet and I don't bring them to that point of, this may never get better. I never say that because I don't know.
It's outlook. It's a positive outlook.
Yes, and if it doesn't get better, that person's going to learn to deal with it, I'm sure.
And do you incorporate personally any mindfulness or any breathing techniques, either during your treatments or personally? What effect do you think breathing has on those patients that have anxiety or other health issues?
I pay attention to breath. It shows a lot about the level of stress that people are in.
Sure.
So people that breathe heavy sighs or even hiccups is another cue for me. And these are kind of, I'll call it what it is. It's considered constrained liver chi. Even though your physical liver is fine, your energetic liver is affected by stress. So
it's amazing.
I watch breath, of course, and I notice for me, especially body work, if my breath changes, that's a place I need to maybe pay a little bit more attention to.
Yeah.
Because sometimes I'll get to where I feel like I can't breathe. Like, my breath has to be so deep in order to get through.
It has an effect on what you do.
It's energetic. And I don't think there's a lot of attention paid to what people are going through. But after so many years of being with energy, I could just feel it from across the room.
Right.
And I try not to judge it.
Right.
Because sometimes I want to say, God, they sound angry, and
you can feel it.
Yeah, I don't want to do that, but sometimes it just happens.
Yeah.
So yeah, I do try to get them to breathe through, because sometimes they feel pain. Yeah. And I'll say, take a deep breath before I put the needle in, and before they can blow it out, I'll press the needle in. And I think they were expecting me not to do it until they exhaled, so I kind of threw them off to where they didn't know when I was going to put the needle.
Right. Well, that's...
I try to adjust it to who it is and what their response is.
Different personalities. But it makes me think about my treatment with chiropractic care.
An adjustment.
Breath. People, when they're in pain especially, they hold their breath. Or when they're anticipating that adjustment.
Correct.
They'll hold their breath. And I always tell them it's more important for you to concentrate on your breathing, but also just listen, and you can feel, and again, after doing this for 25 years,
right,
and you can feel that energy as well. So I just always thought there was probably some correlation there. Yes. And how do you see your work contributing to the overall wellness of our community? Do you get out into the community, or have you seen acupuncture grow in the Lafayette community in the past years? Or not?
See, I know several acupuncturists in the city, and I think the first one I met was John Hebert. Yeah. He was kind of like the pioneer of that, and he really inspired me. And through the process of referrals, I refer patients out to other acupuncturists. We have a 5-element acupuncturist here in Lafayette. It's not the same as traditional Chinese medicine. it focused a lot on emotions and how they affect the body. It's a fabulous art too. I don't understand it anymore. I mean, I studied some of that, but not in acupuncture school. So we were friends in shiatsu, and then went to two different theory schools.
Okay.
But I do notice that people ask more about it, ask questions about it. You know, what should I do? And of course, where I work, there's like 12 massage therapists in the building.
Oh, good.
So there's a lot of referring out, or you know, I like networking.
Yes,
And I
networking
like
is
community
important.
work. You know.
Yes.
I think the building I'm in is really conducive to that.
Well, that helps. And tell our listeners, where are you located?
I'm at 1018 Harding Street, which is called the Harding Center.
Okay.
It's an old oil building from the 80s. Yeah, it was a Unicow building.
Yes.
Yeah, Suite 205G. And it's on the corner of Audubon Boulevard and Harding Street.
Okay. Well,
So-
everybody knows where to find you now. That's
Yeah,
wonderful.
yeah.
And what do you find that over the years, you've grown to love about helping people feel better? And how has your own view of health evolved over the years? Because you mentioned, you started off in psychology and sociology. It really does. I know people listening may not know, but that really must have shaped your foundation for what you do now.
It did, and I think it had more to do with sitting across from someone and, they're sad, they're crying, and, the ethics of social work is you don't touch your clients. I mean, you shake their
But
hand.
it's so important.
Maybe a hand on their back, but you don't hug them. I got to a point where I would walk my clients out into the lobby, like when I'm saying goodbye, like I'm not going to see them again.
Yeah.
And I would hug them in the lobby where there was people around, to where there was no question about, why did she hug
Ethics,
him
right.
or her. So after a while, it was just so, I don't know, like I felt like I couldn't do what I wanted to do or what I was capable of doing for people. And it didn't really change because most of the people on my massage tables out of massage school needed a therapist.
Right.
And all my patients in acupuncture clinic, they sent me all the patients' mental
What a
health
gift,
issues.
though.
Till finally I said, look, guys, don't just give me the mental health patients. Oh, but you're so good with them. I was like, I understand you think I am, but I'm trying to get away from that to where I can work with other people. But when you pull to,
I know.
I'm still pulled to that.
Yeah, it sounds like that's a part of your calling.
I don't think it's ever going to go away.
Yeah, but that's a gift. And what do you find is one myth about acupuncture that you wish you could clear up here and now on Posture and Purpose once and for all? What is the one misconception?
I think number one, that it's painful. Number two, that it's, not really medicine. It's only because we don't know. We don't understand it.
Right.
But I think if people took the time to just read about it.
Educate yourself.
Yes, in simple terms, too. Because when they explained it to me, they made it so simple that it's like I could not understand it. I'm like, well, that makes sense.
And it's not like this was made up about, 20, 30 years ago. This has been around
Correct.
for thousands of years.
Correct.
And that tells you something right there.
And still so. I mean, this is a way of life in China.
Very relevant, yes.
And other Asian countries have their own medicine also, but they utilize energy work like Tai Chi and Qigong. They use body work. And if I'm not mistaken, the Chinese body work was on adjustments. Like thousands of years ago, like chiropractic care might have come from that.
Right.
And then food therapy, where we change the food around. It's not a diet. It's a using food as therapy.
And look at the statistics. Look how healthy. Look at the longevity that they have
Yes.
in those countries.
Correct.
So that,
Yeah.
there's something there.
And then needles. That's the fourth option. They use all those other things first. Needles, and then what they call internal medicine is formulas, herbal formulas, or herbs. So it's from least invasive to most.
Right. Whereas Western,
Yeah, right away.
right away, yes.
And I don't ever speak bad about that because
Oh no, thank God we have it when we need
yes,
it.
and I tell my clients, I mean, you're not going to get rid of your UTI with cranberry juice.
Right.
That worries me that's going to go to your kidneys.
Exactly.
Oh, so what am I going to do? I was like, you go to your doctor.
Right. It's okay. We can
I'm
work
not a
together
proponent
on
for all
this.
that medicine, but you need it
Right.
at times.
Thank goodness we have it when we do need it. So,
Definitely.
and speaking of keeping it simple, if you could give the listeners today one simple practical tip to support their health and wellness today, what would it be? I know you said you tell your clients to walk, but is there something else that you would really say, this is our takeaway today?
I'm so big on being outside.
Yeah, it's a part of healing.
And away from technology.
Mm-hmm.
Because I find lack of presence, there's no exchange for that.
Fresh air, sunshine.
And being present with someone else, good support system, utilizing people.
Right.
Don't allow yourself to be alone.
Yeah, reach out.
Yes. Build your tribe, find your tribe. And I think if we're open to that process, because a lot of us come from so many different backgrounds that we don't even know. I have a friend, she always says, always be kind to people because you never know what they're going through.
Right.
If we always kept that in mind.
Every day.
Yeah, the lady at the red light that's like not taking off fast enough. I've had to practice this all my life. I'm not patient.
Oh.
Yeah. and so as I've learned, through moderation and through time and patience and paying attention and being present, it kind of gets rid of all the busyness of life.
Right. And we all have to practice that every day.
I agree.
So, my last question of the day, and I love this question because I think it is a reflection of, how people present themselves through life. So, how do you maintain your posture while pursuing your purpose in life?
That's a great question. I think I take most of my knowledge about being present I had a wonderful stepfather, and he always had me address things head on. In other words, if you can identify the problem, then you can find the solution.
And work on it.
So I'm not one to avoid,
Yeah, that's a gift.
this is, I'm a good troubleshooter also. So I think, my posture in life is to maybe focus on what I want to change, what I want to do, and be that support system for other people. I'm very strong-willed, and if I want something, it doesn't matter what else is going on. And it's not really a self-centeredness as much as it's, okay, if I do this, then I can do that.
Determination.
Right. And if I could do this for myself, then I can spread that. Yeah. And I love to teach. I still teach CEU classes for massage therapists.
Oh, great.
So I think the way my posture is in life is that, okay, it has to be done, no nonsense, let's get it done.
Straight on,
move on,
Yep.
go to something else. And I don't know, I just feel motivated by that in life, that really that little quiet girl that I was when I was young, that my mom said, oh gosh, you had an attitude. I took that and used that for something good,
for strength.
Yeah.
That's good.
So I think that's where I am with my purpose, so to speak, is, let's get this done.
Yes. Oh, I love that. That's a great note to end on. Let's just get this done. I love it. Well, thank you so much
You're
for
so
being
welcome.
here. I have enjoyed this so much and enjoyed getting to know you for sure.
Well,
So
thank you. I appreciate you inviting me.
thank you. And until next time, sit up straight, stay happy, stay healthy, and stay adjusted.
Thanks for listening to the Posture and Purpose podcast with Dr. Michelle Carr Frank. Make sure to subscribe on YouTube, Spotify, and Apple Podcasts. Until next time.